Stop believing the propaganda about third world medical care. That narrative is keeping you trapped in a system where a single hospital visit can bankrupt you, where you wait months for specialists, and where insurance companies profit from your suffering. Welcome to Beyond Borders Blueprint, where we destroy dangerous myths that keep Westerners paying premium prices for declining healthcare quality. Here's what the medical establishment doesn't want you to know. Countries like Thailand, Vietnam, and Malaysia aren't just catching up to Western healthcare. In many areas, they're surpassing it. While you're getting $500 aspirin bills in American hospitals, millions of Westerners are flying to Southeast Asia for world-class treatment at 80% lower costs. But here's the kicker. The quality often exceeds what you'd get back home. Shorter wait times, newer equipment, doctors with international training, and customer service that treats you like a human being instead of an insurance claim number. Today, I'll show you the real healthcare landscape across Southeast Asia, the costs, the quality, the insurance realities, and why medical tourism is exploding among smart Westerners who refuse to be healthcare prisoners. Your health is too important for propaganda. Let's expose the truth. Myth-busting reality check. Let's destroy the fear-mongering myths keeping you trapped. Myth: third world healthcare means third world quality. Reality: Thailand's Bumrungrad Hospital treats more international patients than most American hospitals. It's GCI accredited with the same standards as Johns Hopkins. Myth: doctors aren't properly trained. Reality: many Southeast Asian doctors studied at Harvard, Johns Hopkins, or Oxford. They return home with Western training, but without Western ego and pricing. Myth: if you get seriously sick, you'll die. Reality: medical tourism to Southeast Asia hit 14 million patients in 2024. People aren't flying here to die. They're flying here to get better for less. Myth: it's cheap because it's dangerous. Reality: it's cheap because overhead costs, malpractice insurance, and administrative bloat are 70% lower, not because the care is inferior. The propaganda machine wants you scared because every patient who discovers Southeast Asian healthcare is a customer lost to the Western medical industrial complex. Time to see what they're hiding from you. Thailand, the healthcare heavyweight. Thailand isn't just the leader in Southeast Asian healthcare, it's setting global standards. The Bumrungrad reality. Walk into Bumrungrad International Hospital in Bangkok, and you'll think you're in a luxury hotel, not a hospital. English-speaking staff, international accreditation, American-trained doctors, and technology that makes most U.S. hospitals look outdated. Here's what will shock you. Specialist consultation: $40 to $60 versus $400 to $600 in the U.S. MRI scan: $300 to $500 versus $3,000 to $5,000 in the U.S. Heart bypass surgery: $15,000 to $20,000 versus $80,000 to $120,000 in the U.S. Hip replacement: $8,000 to $12,000 versus $40,000 to $60,000 in the U.S. The service difference: same-day specialist appointments, not 3-month waits. Doctors spend 30+ minutes with patients, not rushed 7-minute sessions. Transparent pricing up front, no surprise $50,000 bills. Personal care coordinators for complex cases. Insurance reality: Thailand requires health insurance for retirement visas, creating a competitive market. International plans cost $1,000 to $3,000 annually, less than one U.S. emergency room visit. Bottom line: Thailand delivers premium healthcare at developing world prices. It's not just adequate, it's often superior to what you're paying 10x more for back home. Vietnam, the rising powerhouse. Vietnam is quietly building a healthcare system that's making medical tourists take notice. The transformation: Ho Chi Minh City and Hanoi now host hospitals that rival Bangkok's facilities. FV Hospital and Vinmec International cater specifically to foreign patients with international standards. Cost reality: doctor visit: $20 to $40 versus $200 to $400 in the U.S. Dental cleaning: $15 to $25 versus $100 to $200 in the US. Appendectomy, $2,000 to $3,000 versus $15,000 to $30,000 in the US. Cancer treatment, $5,000 to $15,000 versus $50,000 to $150,000 in the US. The expat experience. Digital nomads and younger expats often skip insurance entirely. Vietnamese healthcare is so affordable that paying cash for most procedures costs less than US insurance premiums. The catch: rural healthcare is still developing. Serious cases outside major cities require transfer to urban hospitals. But in expat hubs, the quality is excellent and prices are revolutionary. Vietnam is where smart healthcare consumers are heading before the secret gets out. Malaysia, the hidden champion. Malaysia might be Southeast Asia's best-kept healthcare secret. Kuala Lumpur and Penang hospitals consistently rank among Asia's best. Joint Commission International accreditation, English-speaking staff, and specialties that rival Western centers. Cost breakdown. Specialist consultation, $30 to $50. Knee replacement, $7,000 to $10,000 versus $35,000 to $50,000 in the US. Cardiac surgery, $10,000 to $15,000 versus $100,000 plus in the US. Cancer treatment programs, 60 to 80% less than Western costs. Malaysia's advantage: perfect blend of affordability and quality. Some retirees move here specifically for healthcare access. Their savings last 3 to 5 times longer while receiving better care. Why isn't everyone talking about Malaysian healthcare? Because the medical tourism industry prefers you don't know. The rest of the region. Philippines. English-speaking doctors, excellent urban hospitals, affordable private care. Public system struggles, but private healthcare rivals Western standards at Asian prices. Cambodia. Improving rapidly but still limited. Most expats travel to Thailand or Vietnam for major procedures. Good for routine care, not complex cases. Indonesia, Bali. Decent clinics for everyday needs. Serious cases typically require evacuation to Singapore or Bangkok. Medical infrastructure improving but still developing. The pattern. Even the weaker healthcare systems in Southeast Asia often provide better value and customer service than their Western counterparts. Insurance strategy. Here's how to navigate Southeast Asian healthcare insurance. Travel insurance. Good for short stays, nomads, emergency coverage. Cost $100 to $300 per year. Limitation. No ongoing care, pre-existing conditions excluded. Local insurance. Good for country-specific coverage, lower costs. Cost $300 to $800 per year. Limitation. Usually limited to one country. International health insurance. Good for multi-country coverage, comprehensive care. Cost $1,000 to $3,000 per year. Benefit. Covers medical evacuation, global treatment. The cash strategy. Many younger expats skip insurance entirely. With consultation costs under $50 and most procedures under $5,000, paying cash often costs less than Western insurance premiums. The smart play. International insurance for major procedures, cash for routine care. Quality reality check. Let's address the quality question directly. Doctor training. Many Southeast Asian doctors trained at Harvard, Johns Hopkins, Mayo Clinic, or other top Western institutions. They return home with world-class training but realistic pricing expectations. Equipment standards. Hospitals use the same MRI machines, surgical robots, and diagnostic equipment as top Western facilities, often newer because they're not locked into 20-year equipment contracts. Wait times. Specialist appointment, same day to 1 week. MRI, CT scan, usually same day. Elective surgery, 1 to 2 weeks. Compare that to months-long waits in socialized systems or insurance approval battles in the US. The truth: quality often exceeds Western standards while costs remain dramatically lower. Closing truth bomb. Here's what the Western medical establishment fears most: You discovering that excellent healthcare doesn't require bankrupting yourself or waiting months for treatment. This is Beyond Borders Blueprint, where we expose the truths that set you free from expensive Western systems. The choice is yours. Keep paying premium prices for declining Western healthcare or access world-class treatment at developing world prices. Your health decisions should be based on quality and value, not fear and propaganda. Stop paying Western prices for declining Western healthcare. There's a better way, and it's waiting for you.